In this video, we're going to go through a few tests that you can perform on yourself if you think you may be having a rotator cuff issue. Now, a lot of these tests are designed for someone else, a clinician or a healthcare provider, to perform on you. However, if you don't have anyone that can perform these tests on you, I'm going to show you a way that you can kind of perform them on yourself. The first test we're going to perform is called a drop arm test. And we're going to say it's my right shoulder is the one in question. This is a shoulder that's been hurting. Maybe it's weak. So what I'm going to do is take my left hand on the end of this cane. You can use a cane or a piece of PVC pipe, whatever you want to use, at home you have. And I'm going to bring my arm out to the side. I'm going to hold it right here. And now what I'm going to do is to kind of let go a little bit of the cane or the pipe that you're holding. With your left hand, you don't have to let go completely, because that could cause some increased pain, right? It may hurt if it just drops rapidly. And I'm just going to kind of let go and see if my arm drops down if I'm unable to hold that. Because if you were performing this on a patient or you are the patient having this performed on you, the clinician is going to bring your arm out to the side and then you're going to try to hold it there. And if you can't and that drops, that's going to be positive for a drop arm test, which could indicate a possible rotator cuff tear. Now we're going to perform the lag sign, which is going to check the posterior cuff or the rear cuff of the rotator cuff. You're going to use this cane or pipe, and we're going to say it's my right shoulder. So what I'm going to do is I'm going to bring my hand out in this position. So I'm going to abduct or bring my elbow away from my body, bring my hand back just a little bit in this area here. So I'm using my left hand to bring my hand back there. Now what I'm going to do is try to hold my shoulder and my upper extremity in this position while I kind of let go of the pipe and see if this drops down. If this lags or drops down and I can pull it back, it's a subtle drop and then I can pull back, that would be a positive lag sign, and you could have some pathology on the posterior cuff back here, most especially the infraspinatus or the teres minor muscles. This test, we're going to use a strap. You can use a towel or a belt, whatever you have at home that would work. We're going to perform what's known as a full can test, and then we're going to perform the empty can test. This is checking for the supraspinatus muscle that runs across the top here. That one is the most commonly torn rotator cuff muscle. So what you're going to do, I'll show you the movement, what it should look like. So I'm kind of bringing my arm out, what's called in plane of scaption or scapular plane, so not straight in front, not straight out to the side, but kind of out here in the middle. I'm going to put this strap over at my wrist or just above my wrist and my forearm. I'm going to bring my arm out there. I'm taking my left hand, I'm pulling down, and as I pull down with my left hand, I'm trying to pull up against the strap. And if I do that and that reproduces my pain or symptoms in and around the shoulder joint, most especially right here on the outside, then the test would be positive. Now for the empty can test, you're going to take, just like you were holding a can, in that same scapular plane position, I'm going to rotate down, so kind of thumb down. Have the strap here, I'm pulling up and I'm pulling down on the strap. I'm going to do that same movement. And if that reproduces a pain, again, in and around the shoulder joint, then that test would be positive. The last test that we're going to perform is known as a lift-off test. This is going to check for the subscapularis muscle. So I'm going to put my hand behind my back right here and I'm trying to lift off or bring my hand away from my low back here. If I'm unable to do that or I have significant pain with that, most especially in the front part of the shoulder here, then that test would be positive for possible subscapularis pathology. Hope this video helps to give you an idea if you may be having a rotator cuff issue going on. Obviously, this doesn't replace in-person or medical advice with your healthcare provider. Be sure and talk to them about any concerns that you have, and thanks so much for watching.